This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Located at the front neck, just underneath the muscle layers and skin, the thyroid gland is the largest gland in the neck. The thyroid's primary role is to control your body's metabolism. The problem begins when there is an excessive production of the thyroid hormone called hyperthyroidism.
Hyperthyroidism are function of the thyroid gland. So the anatomical defect, yung lumalaki. Now, the next step would be to determine whether they are hypo or decrease yung function nila, or hyper where there's excessive function of the release of thyroid hormones.
When this happens, you have more thyroid hormones that your body calls for, and you begin experiencing muscle weakness, anxiety, diarrhea, and weight loss, despite feeling hungrier. Thyroid problems may take shape at any age, with women 10 times more likely to be affected than men.
Ang pinaka-nakakatakot sa thyroid disorders is yung bukol ngayon, no? Yung mga bukol, which is actually euthyroid. Minsan normal naman ang function nila, pero may bukol sila, no? Tapos when we do biopsies of them, yung ultrasound-guided biopsy, pag tinusok natin at saka inalam natin kung anong laman, usually may mga certain percentage, in usually 5 to 10% of cases, they become malignant.
That's why thyroid experts suggest annual screening for thyroid function so that an individual need not take the necessary medication or even resort to surgery. What are some consequences of iodine deficiency in relation to the thyroid gland? How can you perform your own thyroid neck check? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Mia Fojas, an endocrinologist at the Manila Medical Center. She's also a director at the Philippine Society of Endocrinology, Diabetes, and Metabolism. Also joining us tonight is Dr. Nemesio Nicodemus Jr., an endocrinologist at the Manila Doctors Hospital. He's the secretary of the Philippine Society of Endocrinology, Diabetes, and Metabolism. You may join in the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to MedTalk.
Good evening, Angel.
The thyroid. Tonight is all about understanding, learning more about the thyroid. Where exactly is the thyroid located and how does it work?
Okay, let us begin by showing where it is really. Most of us would actually associate the thyroid as an organ here in our neck. Mm-hmm. The best position to start is what we call as the cricoid cartilage in medicine, but in layman's term, it's called the Adam's apple.
Okay.
So lahat meron tayo nito eh. Mm-mm. Pero sa mga lalaki, mas prominent ito. Mm-mm. So ang una namin ginagawa, tinitignan namin doon sa leeg ng tao kung saan yung Adam's apple, and then pumupunta kami pababa. Mm-hmm. And then going down, you will see this butterfly-shaped organ na tinatawag namin. Para siyang pakpak ng paru-paro na nakabukas. Mm-hmm. So meron kang left, you have a right. This is the entire thyroid gland. So kapag tayo ay lumulunok, it actually goes up and down. Kaya pagka ina-examine ng doctor yung patient, usually we ask them to swallow. So pagka ikaw ay lumunok, ang mangyayari dyan, tataas bababa yan. Ganon ang nangyayari dyan. So pag hinahawakan namin yung leeg ng pasyente, makikita namin na kapag pinalunok namin, ito ay tataas bababa, mafe-feel namin yung thyroid. That is the thyroid gland.
So now, I'm swallowing while you were explaining. So, okay. Medyo difficulty pa nga ako in swallowing now. Pero,
And that's the
okay.
normal size, ha? So,
Okay.
maliit lang siya. So, hindi siya dapat masyadong nakikita.
Okay, so hindi siya dapat nakaprotrude.
Hindi. In fact, for most people, flat ng neck natin. Wala ka dapat nakikita dyan na nakaprotrude except yung iyong cartilage na ito, yung may
the Adam's apple.
Sa bandang
Okay.
ilalim, dapat flat.
So how does it work? Ano yung, what is its function in our body? Dr. Foaz?
So, lumalabas siya ng tinatawag nating thyroid hormones which govern our metabolic rate and a lot of other functions in the body. So, affected doon yung heart natin, ang ating metabolismo ng pagkain also. So, it also governs kung magkaano tayo magiging kabigat o payat or mataba. But especially important sa mga buntis, no? Sa mga babies, for the first few weeks of life, as fetus, no? Yun yung nag-govern ng growth ng bata. So, yung baby, nagdedepende lang yan sa thyroid hormone ng mother kasi wala pa siyang thyroid gland, yung fetus.
Okay.
Kaya, importante nga yung iodine intake sa mga buntis.
So the thyroid gland of the mother, the baby's thyroid gland is dependent on the mother's thyroid gland.
Wala pa siyang thyroid gland during the first 10 to 20 weeks eh. So, it relies on the thyroid function of the mother.
Okay. And what is the normal function? We talk about the function. No? What is the normal function of your thyroid?
Okay, normally, what we really when we talk about the thyroid gland, it produces two kinds of substances we call hormones. Ang tawag dito, T4, T3. So most people, mas ito yung naalala eh. Ang T4 and T3 are the two hormones produced by your thyroid and they basically control metabolism as was mentioned by Dr. Fohas, pero metabolism ng buong katawan. So yung pag-iisip natin, you think fast because of your thyroid hormones. Your blood pressure is normal because of your thyroid hormones. Your temperature is normal because of your thyroid hormones. Yung bowel movement is also normal because of the thyroid hormones. And even your reproductive organs are normal because your thyroid hormones affect them as well.
Do people realize that?
Mukhang
Do patients realize that? Yung talagang naaapektuhan ang buo nilang well-being because of the thyroid?
I don't think so. Hindi masyado pang hindi pang na-educate a lot of the masses regarding the thyroid.
Perhaps not until may sakit na sila. That's the time they realize, uy, importante pala yung thyroid hormones and thyroid gland. But when they're normal, they basically do not think it's something important.
And sometimes it gets missed, no? If there's a thyroid disease, kung minsan matitreat na yung hypertension, matitreat na yung high cholesterol, when in fact, all of these things were just due to hypothyroidism or hyperthyroidism. Complications already.
Na-neglect because you don't think it is a vital organ in your body that will affect your general
Yes,
well-being.
that's true.
You mentioned T4 and T3. Can we just talk about that a little
Okay.
bit more? What
Sige.
is T3 exactly and T4 in relation to the thyroid
Okay.
gland?
So, kasi yung thyroid nga natin, since this is a gland, meron siyang ginagawang mga substances o yung sangkap. Now, what happens is, yung sangkap na yon dalawang klase. One is called T4. The reason why it's called T4 is because there are 4 molecules of iodine attached to that particular hormone, kaya T4.
Okay.
Yung isa naman, T3, kasi 3 molecules of iodine lang yon.
Okay.
So that's why the hormone is very much dependent on your iodine level in the blood. So kung ikaw ay kulang sa iodine, maaring hindi ka magkakaroon ng enough T4, T3. Kapag sobra naman yung iodine mo, maaari ka magkaroon ng overproduction of T4, T3. And majority of the hormone that comes from the thyroid is T4. Tapos, pag nandun na sa dugo, nako-convert yan into T3.
So that the thyroid makes your body doesn't make iodine, di ba?
No, we have to get it from diet.
And then, so that's when the T4 and T3 will...
The thyroid will make the thyroid hormones
Okay.
from the iodine intake.
Okay.
So, kunwari, kumain tayo ng pagkain may iodine,
Yes,
ano?
diretso
Pupunta yan
yun
sa
doon.
stomach, ma-absorb mo, pupunta sa dugo, and then from the blood, it goes to the thyroid. Doon sa thyroid, gagamitin na ng thyroid gland yung iodine to form T4, T3.
Wala nang
okay.
ibang pinupuntahan ng iodine kung hindi sa
dito.
thyroid gland.
Alright. So there's no other organ of the body na pupuntahan
Normally,
itong
wala.
iodine na to.
Pero pag sumobra ka, lalabas mo yung sa ihi.
Okay. So na-eliminate din ng body mo.
Yes.
Yung normal function.
Yes.
Okay. So that is the normal function of your thyroid gland in
Right.
relation to your T4, your T3, and your iodine intake.
Yes.
In the event that yung hindi normal na yung function ng inyong thyroid, what happens? Or ano yung mga first signs that your thyroid is not functioning well?
There may be two things. Una, yung tinatawag nating morphologic o yung itsura. Kapag ka abnormal na yung thyroid function mo, yung thyroid mo na normally hindi kita, magkakaroon na ng bukol yan. Pagka your thyroid starts to increase in size, sabi nga ni Dr. Fohas kanina, this is the normal size, no? If you suddenly have a thyroid that is larger than this, the entire thyroid enlarges, we call that goiter.
Okay.
Kapag ka buong-buo yung lumaki, it's called a diffuse goiter.
Okay.
Pero kapag ka halimbawa naman, instead of having an enlargement of the entire thyroid, you actually develop a mass or a nodule, kagaya nito. Ang tawag natin dito, it's a thyroid nodule or a nodular goiter. Pero pwedeng hindi lang isa. Pwede kang magkaroon ng madami. No? Ayan. Pagka ikaw naman ay marami, both left and right ng iyong thyroid, maraming nodules, we call it multinodular goiter. So, yun yung pwedeng mangyari in terms of anatomy. Pwede kang magkaroon ng paglaki ng thyroid, which is called goiter. Sa mga Filipino, ang tawag din natin doon, bosyo.
Bosyo.
Bosyo. Sa mga probinsya lalo na. Pero, pagka naman hindi lumalaki yung thyroid mo, pero abnormal naman yung function, meaning dumodami yung T4, T3, isa pang sakit yun. Ang tawag naman doon, hyperthyroidism, or we also call toxic goiter.
Diffuse toxic goiter.
Yes. Pwedeng diffuse toxic goiter, pwedeng nodular toxic goiter.
Yung bukol lang yung may problema. Siya yung naglalabas ng T4, T3.
Okay, so yung buko lang ang may problema, not necessarily yung buong thyroid gland.
Yes,
So what you've mentioned, goiter, hyperthyroidism.
At saka yung kabaligtaran nun,
Hypo.
hypothyroidism.
So those are thyroid problems no, that we will discuss in a while. But Doc, are thyroid problems prevalent in the country? Marami bang may goiter? Marami bang may hypo and hyperthyroidism?
You know, we did a study sa Philippine Society of Endocrinology, Diabetes and Metabolism a few years ago, and this was in cooperation with the Food and Nutrition Research Institute. A nationwide survey was conducted, and we found out that among Filipinos, 9 out of 100 have goiters. And that is even greater than the prevalence of diabetes in our country, which at that time was only 7 out of 100. 9 out of 100 have goiters. And when you talk about alin ba dito yung diffuse at alin dito yung nodular, they found out that among those who had goiters, 6 had diffuse goiters compared to 4 na may nodular goiter. So marami sa mga kababayan natin ang merong goiter na diffuse, yung malaking-malaki yung buo, pero meron din yung mga may mga bukol-bukol.
So mas prevalent ba to sa rural o sa urban
Okay.
area?
In that particular study, we were not able to distinguish rural and urban because the prevalence worldwide, nationwide rather, is not yung wala yung sabihin mong mas marami sa isang lugar
It's
o mas
very difficult
kaunting-kaunti.
to classify
Oo,
kasi
and it doesn't matter also, would you say na
Yeah.
kung in the provinces, they have more access to iodine intake.
That's
Tapos
true.
sa city, mas konti ang access to iodine intake.
Yeah, that's because meron naman tayong asin law, matagal na, and we are required, nationwide, kailangan mag-supply ng iodine sa all salts. Kaya it should not be one of the bigger causes for the thyroid disease. But the data is comparable to other Asian countries
That's
as
true.
well. So mas prevalent sa mga Asians kesa sa mga Caucasians.
Okay.
And you would think that people near the sea, yung
Yes,
mga maraming mga,
oo.
dapat less yan, di ba? Yung iodine deficiency.
Yes.
But the latest data showed that yung critical areas sa Philippines na merong high prevalence of iodine deficiency, Zamboanga. Considering na napapalibutan na ito ng dagat, it's one of those areas that has a critically low, a high level of iodine deficiency in our country.
I wonder why, no? Na you'd think na yun na nga because they have more access to the
There
to
are
seaweed,
other causes.
which is a
Exactly.
good source of
maybe
iodine,
hindi
no?
talaga
Hindi
iodine
talaga.
deficiency ang cause ng disease nila.
Oo,
Okay.
meron pang iba. Meron pa
So,
ibang dahilan.
baka hindi iodine deficiency ang cause, meron pang iba. We'll
Risk
find out
factors.
more about thyroid problems when MedTalk returns.
Add thyroid disease to the long list of negative effects of cigarette smoking. Studies suggest that smokers are more susceptible in developing thyroid eye complications of Graves' disease, with treatment more likely to fail with the habit around.
We're back here on MedTalk, still talking about thyroid problems. Doctors, we've been talking about iodine, and I'm sure our viewers are curious to find out what exactly is iodine, how much do we need iodine in our diet, sources of iodine as well. So, what is iodine in
Iodine-
relation to our thyroid gland?
Right, right. Iodine is a trace mineral. So pag sabing mineral, dapat hindi mo naman kailangan ng maraming-marami nito. And it's usually found in the environment. The most common and the most important source of iodine are really seafoods. So ito yung ating mga shells, yung mga sea fishes, and even seaweeds. These are the most important sources of iodine in the diet, the natural diet.
Okay.
But mentioned a while ago by Dr. Fojas was the asin law. Diba? During the time of President Fidel V. Ramos, he made it, that particular law was enacted requiring all manufacturers of salt to put iodine, kaya nga iodized salt. And that was an answer to the problem ng iodine deficiency in the Philippines way back then.
I remember there was a jingle pa. Di ba?
Yes, yes.
Right.
Right.
One,
oo.
no?
Hindi ko
Yeah.
narinig
There
yan.
was.
Yeah, to remind everybody that we
Correct.
need iodine in our diet.
And also, dairy products are now fortified with iodine.
Correct.
It's required for growth of the children.
Okay. So, you need shellfish
Yes.
as part of your diet.
Not really need, no? You need iodine.
Iodine.
You need iodine
Not
rather, which
shellfish.
you get from the shellfish and
Yeah,
and,
you-
and,
and other-
dairy. What if you're allergic to shellfish?
Yeah.
And
There
dairy?
are other ways, no? There are multivitamins now. Pag non-pregnant, no, usually 150
supplements
micrograms
na.
of iodine. No, 150 micrograms of iodine required for non-pregnant women and also the boys, no? Pag pregnant, 200 micrograms. So may multivitamins naman. At saka
Okay.
you can get from other sources, well, aside from the milk, other dairy products, yeah, cheeses, etc. Marami naman.
And
So,
the iodized salt na rin.
o iodized salt na rin, just in case nga. Because
Kakain na.
sometimes, no, nagde-develop ka ng allergies to dairy. Maybe you're,
Yes.
you're lactose intolerant and you can't take dairy.
Pwedeng yogurt.
Pwedeng yogurt. Okay. So, what other sources and how much should we?
150 for non-pregnant, 200. Iodine to 200 micrograms for pregnant patients. You take a look at the multivitamins Meron
Okay.
talaga.
Meron talagang iodine
Pero of
doon.
course, some people hindi naman required. For the hyperthyroid patients, conscious tayo na hindi niya dapat matake itong vitamins na may iodine.
Okay. So,
Pero kung gagawin
yes.
nating practical, kunwari, sa mga nakikinig, paano kung hindi ko alam kung ilan yung 150 micrograms tsaka 200? Gaano karami ito? Sabi nila, based on studies, if you want to have a regular supply of iodine daily, you should eat 2 medium-sized crabs. Yun.
Daily yan?
Oo, daily to.
Wow.
2 medium-sized crabs. 1/2 cup of shellfish. 1/2 cup of hipon. Or you can even take 2 1/4 pieces of squid or yung pusit.
Granting you don't have allergies
Okay.
and you have normal cholesterol levels and
Okay.
uric.
Kasi daily to eh. It's a
And
daily
uric
requirement, so to
Right.
speak, no?
Right.
Wow. Do you do that, Doc?
No. Kasi what I do is, of course, I try supplementing other sa iodized salt. Siyempre, yung seafood naman, although I'm not allergic to it, I love seafood. I seldom eat it on a daily basis. Perhaps 2 or 3 times a week lang.
Okay. So that's okay na.
Yes.
Kasi you get it from other sources.
Right.
Doc,
Well, I'm allergic to a lot of seafood.
okay. So where do you get your
I get it from
source of iodine?
multivitamins and I drink milk every day.
Okay. So there, sometimes we'd also like to know habits or the diet of our doctors. So we can emulate, we can refer to your diet para mas maging healthy kaming lahat ng mga patients. Doctors, we mentioned that we're going to discuss thyroid diseases. Let's talk about the first thyroid disease here on my notes. It's hyperthyroidism. What is hyperthyroidism exactly?
Sige. Hyperthyroidism is a disease state wherein sobra yung dami ng T4 and T3 na ginagawa ng thyroid. So kanina, sinabi natin kung ano yung T4, T3, no? Kapag sumobra yon, ang tawag natin doon, hyperthyroidism. So because you have elevated T4, T3, you will have symptoms of abnormal hormone levels like nagsisimula ka ng magpalpitate, bibilis yung tibok ng puso mo. Magsisimula kang manginig, yung mga kamay, you have tremors. Pwede kang magkaroon ng sobrang pagpapawis even if it's cold in the environment. And madalas kang pumupunta sa CR to move your bowels. Kasi nga, they regulate our temperature, our heart rate, and even our bowel movement. And most of the time, ang pinakaunang mapapansin ng pasyente, they lose weight. Initially, they feel masaya kasi
They feel good.
pumapayat sila.
Sino ba namang hindi may gusto that you lose weight, no?
Sa mga
Initially.
maarte, sa mga females, they usually lose hair, no? Or thinning of hair. Kaya
Okay.
no matter how much you do sa hair mo, parlor, wala. You lose hair. Kung minsan, kung sobrang tagal na, medyo nakakalbo patches na siya.
Okay.
And mas madaling umiitim. Kasi ang bilis ng
Even
turnover.
without exposure to the sun, yung
Mas mabilis kasi yung turnover ng skin cells, tapos madaling mag-slough off. So yung baby cells, may exposed konting sunshine, it's very sensitive. So nagda-dry ang skin or madaling umitim also.
Okay.
So they're usually darker.
Does this happen over time or
Yes.
biglang mangyayari to
Ay,
lahat in
over
one blow?
They happen over time, but usually it's very rapid. Hindi ito yung tipong a year bago lumabas lahat ng symptoms. Sometimes the symptoms can appear within a period of weeks.
Yes, weeks.
Within a month, lahat na yun, magkakaroon ka na ng weight loss, mabilis ka nang mapagod, hinihingal ka na, nagpapalpitate ka na, and it can be very bothersome to a patient.
Some other patients would think that they have cancer already.
True.
Ba't ako pumapayat?
Right? Without
Or
doing
kasi
anything.
with the thinning of the hair, no?
Mukha kasing tumatanda when they lose weight also.
Okay. So, paano yan napapansin before going to your endocrinologist? I have friends who have been diagnosed with hyperthyroidism and they notice it sa mga pictures. Nagbabulge yung mata nila. That's also a symptom, no? Or a sign
Actually,
na
yung
nagbabulge.
bulging of the eyes,
Can be
ang tawag namin doon is ophthalmopathy. And it's a particular type of complication related to yung isang type ng hyperthyroidism, which is Graves' disease.
Okay. What
Oo.
exactly is Graves' disease?
Graves' disease naman is a form of toxic goiter kung saan ang cause is autoimmune. So meron ka, yung dapat na nagpo-protect ng body mo against infection is attacking your body. And it is attacking your thyroid to produce more of the thyroid hormone. And it even attacks the muscles at the back of your eyes. Kaya namamaga yung muscle mo, kaya napoprotrude, tinutulak palabas yung mata mo. Pwede ngang isa lang mata ang lumalaki.
Yeah.
Really?
Oo.
Yes.
Hindi siya
Actually,
subay
it's
na, sabay na nagpo-protrude?
Hindi ganun kasi depende sa tinatawag na receptors. No? Ang problema kasi doon sa Graves' disease, this is after the name of a doctor, Richard or Robert Graves, no?
Yes.
Graves talaga may S.
Okay.
Ang nangyayari, may tinatawag na TSH receptor antibodies. No? Ang nangyayari, dapat dito, yung thyroid gland natin, pag marami siyang nilalabas na T4, dapat alam ng utak na marami na siyang nilabas. So, sasabihin ng utak sa thyroid, stop na muna. Kaso, ang nangyayari yung thyroid, hindi siya nagre-respond sa brain because of the problem doon sa receptor. Hindi niya naririnig yung sinasabi ng brain. So, ang problem is that yung receptors, yung kinakabitan nung substance na yun is similar doon sa may likuran ng mata. Kaya, while you have that disease in the thyroid, ganun din yung mangyayari sa mata. Kaya nagpo-protrude siya. Kaya namamaga siya yun. So, but once you treat this, posibleng umokay yun. Posible. Pero kung minsan, may separate pang gamot siya.
Okay, yung the
Yung
protruding
mata,
of the
oo.
eye, hindi lang ito yung ititreat separate as you
Pwedeng
mentioned.
separate. Pwede kasi siyang kung masyadong matagal na hindi naman masyadong pinapansin, no? Kung masyadong matagal, baka separate treatment pa 'yon. After matreat ito, meron ka pang ibang gamot na bibigay para sa mata.
Yung mga symptoms that you've mentioned, baka others nga might think it's cancer, no? Others might think they're just so stressed.
True.
Na after a few weeks, after maybe a big meeting or they're finishing a project, mawawala lang to. Does it just go away? Or do you really need medical attention pag
Doesn't
nakita mo
go
na itong mga
away,
symptoms?
no? It's life-threatening.
Unfortunately, if you leave it untreated, it will get worse. And that's the reason why it has to be recognized and treated properly.
What could be the possible complications
Yeah.
of hyperthyroidism?
Earlier said, no, sinabi ni Doc Nemi na the thyroid governs the function of the heart, etc. So sa heart, pwedeng umiba yung tibok ng puso, tinatawag na atrial fibrillation. Pwede ring, sobrang bilis kasi ng heart rate natin, pwede siyang lumaki. And that is not reversible anymore, no? Pwede kang magka-heart failure.
Yes.
Also, pwedeng maapektuhan yung atay natin. Thyroid-related hepatitis, pwede mangyari, namamaga din yung atay. Sa mga babae, pwedeng maapektuhan yung fertility. So, pwedeng tumitigil ang menses, hindi sila makabuo ng baby. And it's very dangerous. Even if they get pregnant, dangerous, pwede silang magka-miscarriage.
Okay.
So, very complicated. You can actually die from untreated thyroid, hyperthyroidism.
The extreme case is yung tinatawag naming thyroid storm.
Yes.
Pag sinabing thyroid storm, sobrang ng taas ng level ng thyroid hormone mo, na nilalagnat ka na, sobrang ng bilis ng tibok ng puso mo, nahihirapan ka ng huminga, namamanas ka na. Pag dinala ka sa ER, there are cases na kapag hindi nagamot properly, they might die of it.
Lalo na pag naninilaw na.
Yes.
Oh, naninilaw na. That means yung liver nila apektado na.
Sobrang problem.
So talagang once you notice these signs, no, na mention nyo,
Don't wait for those.
no, you shouldn't na, no.
Right.
Is it genetic?
That's a good question.
be.
Most of the time is familial. It runs in the family. So kapag si nanay o si lola merong toxic goiter, kailangan yung mga apo at mga anak nagpapacheck din regularly because that's the most common risk factor for developing a thyroid problem, the family history. Pero meron ding ibang dahilan. Like for example, if you have iodine deficiency or iodine excess, pwede ka rin magkaroon. Stress, as you mentioned, stress is
Pwedeng
already a
mag-trigger.
well-known risk factor for developing hyperthyroidism or toxic goiter. So tama yun, na kapag yung ibang mga pasyente nagkaroon lang ng stressful life event, kunwari nakipaghiwalay sa boyfriend,
Yes.
o kaya merong mga, of course, if a loved one dies,
Yes.
that can be a severe stress to trigger the development of hyperthyroidism.
Oh, the stress kasi decreases your immune function. Kaya also you can have a viral infection which can trigger some kind of a thyroiditis. That's why the function is affected.
How about the work environment, those exposed to radiation?
Radiation, yes,
Are they at
that's
risk
true.
as well?
Yes. Pwedeng mostly hypothyroidism.
Okay.
Kasi radiation therapy nga yung nangyayari doon
okay.
Sometimes may pre-medication naman yun, binibigyan ng higher dose of iodine for these workers. Kaya nape-prevent
Pero
yung
alam mo,
occurrence.
recently, there have been reports na in the environment, it's not just the radiation, but even the chemicals that we find in the food. Meron tayong tinatawag na endocrine disruptors. Ito yung mga chemicals sa pagkain natin na maaaring hindi na-recognize before, pero ngayon they are slowly identifying them as the ones that disturb our thyroid.
Would you have any example before we cut to a break? An
Example nito,
of that?
very classic example, the Teflon, where we usually
yes.
cook, di ba?
For
Using
cooking.
for
Yes.
cooking. That has been found to be an endocrine disruptor that could affect the thyroid hormone production.
Oh, wow. Okay.
So it's some as
But this
pag
is
chronic
a
exposure na to.
correlation
ah.
to, correlation. So,
Hindi
the
naman yung isang
mechanism
gamit
hindi
lang.
pa.
Hindi naman isang gamit lang that it can
Meron
lead
na
to
yun.
a thyroid disease, no?
Or those who probably make Teflon.
Yes, oo. So talagang may mga small substances na that can affect. So that's in the environment as you mentioned.
Okay. We'll also talk about hypothyroidism. What is it in relation to the thyroid gland? What is the difference or similarity to hyperthyroidism, doctors? We'll talk about that when MedTalk returns. We're back here on MedTalk, still talking about thyroid problems. Doctors, we've talked about hyperthyroidism. This time, let's talk about hypothyroidism, which is linked to weight gain. Is that true?
Yeah, pwede. Yes. And in some cases, wala namang masyadong weight gain. But we'll talk about that later.
Okay.
Regarding hypothyroidism, this is the complete opposite of hyperthyroidism. So ito naman, mas less or halos wala nang nilalabas ang thyroid gland natin na T4 at saka T3. Kaya siya tinatawag na hypothyroid. So pag hypothyroid ka, I'll talk about the symptoms. So
Yes.
mas mabagal ang metabolic rate. So kung minsan mas mabagal din yung heart rate, no? Kaya ang nangyayari, pareho rin sa hyper, nagkakaroon sila ng palpitations. Lalo na kung halimbawa hypothyroid tapos tumatakbo, parang hindi maka-cope up yung heart. So nagpa-palpitate din sila. So yung regarding yung mas mataba, no? Kasi nga ang nangyayari mas mabagal ang metabolic rate, mas mabagal ang metabolismo ng pagkain. So mostly nade-deposit as fat or in some cases dahil din ang pasyente nagmamanas.
Okay.
Pag hypothyroid sila. Kaya parang mas mabigat sila. Ang bagal pa ng metabolic rate. Kaya ganon. So, madali lang naman i-manage medyo ang hypothyroidism kumpara sa hyperthyroid na mas nakakamatay yung isa. Kasi hypothyroidism, kulang ka lang naman ng thyroid hormone, di bigyan mo ng thyroid hormone.
Oo,
Tapos, which is
i-regulate.
available always.
Kasi yung hyper, mas bumibilis yung heartbeat.
Yes.
So talagang mas the incidence of heart disease is
Correct.
higher than hypo.
Hypothyroid, meron din, but that is secondary to, let's say, high cholesterol levels, yung complicated na. Pero if found early, mas madali siyang i-treat. Hindi siya masyadong nakakamatay, unlike hyperthyroidism. Kung yung hyperthyroidism, meron siyang tinatawag na thyroid storm, na it's an emergency case. Doon naman sa hypo, myxedema coma. So parang tulog siya forever, bumabagsak yung sodium, so parang nawawala din sila sa sarili. So yun yung myxedema, pero hindi siya masyadong common.
Okay.
Kasi mas maraming iodine intake, mas madaling ma-recognize kasi yung pasyente parang lantang-lanta na, parang walang ganang gumawa ng anything before that happens.
Okay. To share lang with everyone, no, I was diagnosed with a hypo. And yung sinasabi mong lantang-lanta,
Yeah.
I felt that way, tapos my skin was rough, and
Yes.
I think my TSH, the thyroid stimulating hormone, was down or mabagal
And
siya.
TSH would be high in hypothyroidism
okay.
because yung utak nagsisignal sa thyroid gland na, sige, maglabas ka pa ng thyroid hormone, so the TSH goes up. Ayaw ng thyroid gland maglabas ng T4, T3. Kaya pinipilit niya pa rin. Ang tendency, pag hypo also, lumalaki yan kasi pinipilit ng TSH, thyroid stimulating hormone. It stimulates the thyroid gland. So, iba yung lumarami, no? Hindi siya makaproduce enough.
Okay.
So, yun ang nangyayari. Tapos, regarding the skin, ano?
Yes.
So,
Naging rough siya, na parang scaly in a way.
similar to hyperthyroidism, there are skin changes. Sabi ko nga kanina, pwedeng maging dry also. Sa hypo, nagiging rough skin. Tapos sa hair also brittle. So madaling napuputol yan. No matter how much rebonding you do, nangyayari yan.
Or no matter how much conditioning and hair mask you
Yes,
do.
oo. Tapos, tapos medyo maga din. Nagmamanas.
Mamanas
So,
din.
nangyayari.
How about the eyes? Similar din sa hyper, nagbabulge din.
Hindi yung mismong mata ang nagbabulge, kung hindi yung talukap ng mata. So what happens is nagkakaroon ng pamamanas around the eye such that the patient looks like as if kababagong iyak lang niya o bagong gising.
Dito kasi yan yung talukap, no? Tapos
Oo.
it's parang
Ang
magang-maga.
Parang namamaga, parang kang bagong iyak.
Oo.
Usually yung description ng mga pasyente na parang namamaga yung paligid ng mata nila kasi nga nagkakaroon ng kaunting manas, and that also involves yung part ng eye natin, yung sa patalukap ng mata, doon din namamanas. Kaya mas parang bulging.
At naaagapan naman when you see all these symptoms, no? Aagapan.
Pag
Kasi you said
hypo.
treated early. So are there stages in treating hypothyroidism?
Even if it is very treatable, the problem is the symptoms that was mentioned by Dr. Mia a while ago, hindi ito nagde-develop over months. They develop over years.
Yes.
So, ang nangyayari
I
tuloy,
agree.
di ba? So, ang
Yes.
nangyayari, yung pasyente, ina-attribute niya lang to something else other than a disease. Kaya kung tawagin siya silent menace. Kasi nga, ang nangyayari, you develop the disease, without knowing it. Kasi akala mo tumatanda ka lang. Nagda-dry lang yung skin mo.
Part
akala
of the aging process lang siya.
Process, bumabagal yung pag-iisip mo, nagkakaroon ka ng mabagal na pagkilos kasi akala mo tumatanda ka lang without knowing that the reason why you are developing those kasi hypothyroid ka na pala. So, pagka dumating yung panahon na yon, usually doon na lang nagkakaroon ng consultation sa doktor. Unfortunately, that happens quite late in the game.
Okay.
Even if it is very treatable, hindi siya nare-recognize kaagad. So, once we recognize it using blood test, nabanggit nga kanina ni Dr. Mia, mataas ang TSH, then we start treating the patient already with thyroid hormone replacement. And of course, part is to give them dietary advice to increase their iodine intake.
What does the thyroid hormone replacement do? How does it regulate your T4, T3, TSH?
It's the thyroid hormone replacement therapy. Meron kasi tayong similar to the T4. So that's what you call the levothyroxine. So that's what you're supposed to take early in the morning as soon as you wake up. So yun yung replacement na binibigay. On the other side, no, I'd like to say yung
Yes,
sa
please.
mga patients, kaya silent menace also, when they consult with the doctor, sometimes yung complication na halimbawa sa skin. Kasi yung iba nagkakaroon ng tinatawag na mukhang orange skin appearance nun sa legs, pupunta sila sa derma. So yung ganon. So sa hair, ikaw consult nila more, kasi more usually sa mga girls. So kaya ibang nakokonsultahan nila, hindi talaga maa-attribute nila agad sa thyroid.
You mentioned girls, no?
Yes.
Bakit mas parang prevalent siya sa girls? Mas
Actually,
concern ng
yeah.
girls yung mga na-mention ni Dr. Fojas.
Kasi hindi lang sa Pilipinas, but worldwide, the prevalence of thyroid disorders is 3 times higher in females compared to men. Kahit dito sa Pilipinas, 3:1. Mas maraming babae nagkakaroon ng thyroid disorders like hyperthyroidism and even hypo. It has something to do with the other hormone that females are also producing, the reproductive hormones. So, merong interaction yung thyroid hormone and the reproductive hormones ng babae to increase the risk of developing thyroid problems.
Okay. How about the risk of developing thyroid cancer? Is it more prevalent in men or women or both?
Okay, worldwide and even sa Philippines, meron tayong data showing that the prevalence of thyroid cancer is increasing over the past 20 years. As far as the number of thyroid cancer cases, halos pareho sa babae at sa lalaki. So pagdating sa cancer, walang pinipili. Parehong nagkakaroon ng thyroid cancer ang lalaki at babae. And the factors associated with it include family history. Kung meron kang magulang na may thyroid cancer, mas malaki yung chance mong magkaroon. Iodine deficiency can also lead to thyroid cancer in some cases. Exposure to radiation, as mentioned a while ago, this can also be risk factors for the development of thyroid cancer. And there may be other factors na hindi pa known as of now, pero yun yung mga pinaka-common causes kung bakit ka magkakaroon ng thyroid cancer.
Physically, anong nakikita in this area pag one has
Ang mahirap
thyroid
nga kasi
cancer?
sa thyroid cancer, wala kasi siyang symptoms.
Hindi siya parang hyper or hypo na
Wala.
nagbabulge yung talukap ng
Wala.
mata or lumalaki yung dito, the skin, the hair.
And you know what, if you have hyperthyroidism, likely wala ka namang thyroid cancer. Usually gano'n, no? So usually, normally functioning thyroid lang. Tapos sasabihin, ay bukol, yung nanay ko lumaki, malaki na nga bukol, hindi pa pinapa-operahan. So walang fear. Kaya hindi agad na tatanggal.
So yung bukol na yon, they might think goiter siya na pwede lang
Yeah.
operahan at liliit at with medication and
Or
proper
hindi
treatment.
gagalawin.
In fact, hindi kasi associated dun sa pag mas malaki ang bukol, mas malaki ang chance ng cancer.
Walang
Hindi ganun eh. Sometimes, thyroid cancer presents to you as a very small nodule. Kung kaya't
Parang
hindi,
yung nodule na pinakita niyo sa
maaring
sa
ganito
akin
lang
kanina.
kaliit,
Yes.
pero pagka biopsy, usually, yung pala nandun sa loob yung cancer. So it doesn't have to be very big for it to be cancerous. In fact, may mga patient who have a very large goiter and yet benign yun, hindi cancerous. So the reason why it's a problem is because walang particular pattern na pwede mong sabihin na kapag ka ganito yung itsura ng bukol mo, pagka dito sa left side, cancer yan. Kapag ka ganito kaliit, cancer yan. Hindi eh. It is a mixture of several findings. But the most important thing that we do as doctors to diagnose it is to do a biopsy.
Okay.
So,
Basta
Thyroid
may
ultrasound.
nodule na,
Oo.
or an ultrasound, no? Basta may nodule na naramdaman or nakita ang mga doktor, you should immediately get a biopsy.
In most cases, yes, we do recommend. But depending on the appearance sa ultrasound, maaring hindi naman ipabiopsy.
Okay. So not all nodules
Kasi
require a
sa
biopsy.
ultrasound, meron ng finding doon that tells you na, oh, high risk to for cancer. Malamang cancer to sa ultrasound pa lang. And you can actually guess kung anong histopathological diagnosis nun. Pero in some cases kasi ang mahirap, kung multinodular, kung maraming bukol, pwedeng isa lang doon ng thyroid yung cancerous, yung iba hindi. So, sino ba naman magpapabiopsy ng marami?
Oo.
So, importante talaga yung ma-ultrasound para makita mo ang character ng bawat bukol. Or, later on, pwede ka rin magpa-opera. Kasi that's the final diagnosis. Pwedeng kung minsan pag biopsy, colloid lang siya, meaning hindi siya cancer. It looks benign. But pag tinanggal, cancer siya. So, you can miss it because of pag nag-biopsy, hindi naman lahat yan matutusok. Yung isang bukol, hindi yan matutusok sa lahat. So, baka ma-miss. So, kailangan, it's a clinical decision for the doctor.
But it's important that we recognize thyroid cancer kasi thyroid cancer, unlike the other cancers in the body, kung tutuusin, it is one of the most treatable cancers in the body. There are 4 types of thyroid cancers. Meron tayong tinatawag na papillary, follicular, anaplastic, and medullary. Dalawa dito, madaling magamot, like papillary and follicular. Pag sinabing madaling magamot, you can have a cure rate of as much as 95% in 5 years. So maganda ang survival rate. So,
If diagnosed early.
if diagnosed early and if treated properly, maganda ang survival. In fact, here in the Philippines, we have the Philippine Thyroid Cancer Support Group, a group of thyroid cancer patients who organize themselves into a group to support each other, especially those na newly diagnosed cancer patients. And there are patients there na 20 years nang may na-diagnose ng cancer, 20 years ago and still alive, still no problem, still very
Parang
strong.
normal lang na
It
individual.
doesn't affect the speech, it doesn't affect this
no.
area. Wala.
The thyroid surgery matters, no? Kaya yung speech, they worry about
Yes,
that.
yes.
So, it's important for us to note na wala naman masyadong incidents. Mababa na yun yung mga nagpapaos, no? Unless nag-invade na doon sa voice box ng
Okay.
pasyente. Ibig sabihin, pangit na cancer na yon. Pero ngayon, hindi na kasi magagaling naman na yung mga surgeons. Hindi na yung operasyon na nasa tabing ilog. Hindi ganun siya.
Very modern technology already
Modern.
when treating
At saka
thyroid
maliliit
cancer.
na yung
Right.
hilog.
And they tend to be less invasive now pagdating sa procedures, pagka-opera. Unlike
good to
before
know.
na ang takot ng pasyente, baka ang laki-laki ng hiwa sa leeg. Ngayon, the surgeons are very meticulous in that they want a very small incision para dun lang sa ibabaw ng natural mo na guhit sa leeg para pagka nagkaroon ka ng scar, parang hindi totoong, parang hindi nakikita yung scar.
Post-operatively, meaning after nung maoperahan, posibleng magkaroon ng voice changes. So parang manamamaos kasi namamaga pa yung area. Pero in time, when you start giving yung replacement therapy, bibigyan mo ng thyroid hormone, nawawala din yon.
Okay. So that's good to know, no? Na no fear na maapektuhan yung kanilang speech. They'll live a good, normal
Yes,
life.
yes.
And then for females, no? Men as well, no?
Yes.
Yung the surgery here, na hindi masyadong halata. Basta diagnosed early,
Yes.
it is treatable and
Yes.
you will get well from the cancer, no?
Right.
Doctors, the last week of January is Goiter Awareness Week.
Thyroid awareness.
Yes.
Well,
Goiter-
thyroid,
goiter
goiter
awareness.
awareness
Yes.
week. We will talk about that
Yeah.
when MedTalk returns.
Hypothyroidism has often been tagged as the great imitator and silent menace, as it can reportedly imitate at least 50 medical conditions.
We're back here on MedTalk, still talking about thyroid problems. Doctor, the last week of January is Goiter Awareness Week, or GAW.
Yes.
Please tell us about this.
Yeah, the Goiter Awareness Week has been, the last week of January has been designated as the Goiter Awareness Week as early as during the time of President Macapagal Arroyo. So what is the purpose is to inform the public that indeed checking your neck to see if you have goiter is very important, because as we saw dun sa ating study that as many as 9 out of 100 patients, or Filipinos rather, have goiter. So ngayon, nagkaroon ngayon ng programa ang Department of Health, at ito ay in collaboration with the different medical societies, and that includes the Philippine Society of Endocrinology and Metabolism, na i-promote yung awareness ng goiter. Kaya every last week of January, nagkakaroon ng mga activities nationwide to educate the lay na kung paano malalaman kung may goiter ikaw. Tapos para kung may malaman na may goiter ikaw, then you can consult a doctor to find out if you have hyperthyroidism, hypothyroidism, or just plain non-toxic goiter, or even thyroid cancer, as we mentioned a while ago. This year, the activity will be held in Legazpi, Albay. So doon magkakaroon ng press conference during the last week of January to kick off the activity for the week, Goiter Awareness Week. And we, in the Philippine Society of Endocrinology, Diabetes, and Metabolism, will have our own lay lectures around Metro Manila and even in the provinces.
So medyo nauna-una na tayo dito sa MedTalk with
the
our
reason also-
information and
Kasi
understanding
gusto
of the
din nila
thyroid.
at that time, kaya tinawag lang na Goiter Awareness Week. They just wanted to stress out the importance of iodine supplementation at that time. But right now, it's not just focusing on goiter. So a lot of the other thyroid diseases, including thyroid cancer, and how to check your own neck.
Okay, you mentioned how to check your own
Check
neck.
neck.
Let's take it from there. How do we check our own neck? Thyroid
Okay.
neck
Sige,
check.
gawin mo.
Thyroid
Paano
neck
ba
check.
yan, Doc?
Ang pinakamadaling gawin yan, kumuha ka ng baso na may tubig.
Okay.
Ngayon, dapat nakaharap ka sa isang salamin. Ngayon, habang ikaw ay nakaharap sa salamin, iinom ka ng tubig. So, ang titignan mo, syempre dapat yung suot mo, medyo hindi kagaya ng suot ko na nakatakip yung aking
Pwede
neck.
tong medyo
Pwedeng
ganyan.
Plunging.
Tapos, habang
Okay.
ikaw ay umiinom ng tubig, titignan mo ngayon yung neck mo doon sa salamin kung merong bukol na umaakyat, bababa, aakyat, bababa. Kasi, maaring yung umaakyat, baba na yon ay bukol na pala sa iyong thyroid o yung nodule. Or maaring yung thyroid mo malaki na. Pero kung ang nakikita mo lang umaakyat, bumababa, yun lang iyong Adam's apple, maaring normal ka lang, hindi malaki yung thyroid mo. Pero kung meron ka nang makita at makapangbukol dyan, dapat magpakonsulta na sa doktor. Kasi the doctor can do a proper physical examination of your neck to find out if you have goiter or not.
Okay, so yung tip, Doctor, gaano ba kadalas kailangan gawin?
Kung wala ka namang goiter ngayon, it's less likely that you will have a goiter within 1 year. So hindi naman ito kailangan linggo-linggo ginagawa.
Or every time na iinom ka ng tubig at haharap ka sa salamin, you have to check your neck.
Hindi
Hindi
naman.
naman. Pero you have to do that kung
If you have a family
if you have a
history,
family history.
lalo na. If you have a family history. Or lalo na sometimes if your friends suddenly tell you, bakit parang may bukol ang leeg mo habang nagsasalita ka? Then that's the time, perhaps you should do it on yourself muna. Check mo muna yung neck mo.
Ano yung importance of doing the thyroid check?
Of
Neck
course.
check.
Doing the thyroid neck check is the pinaka-cheap way of knowing if you have goiter or not. Kasi syempre, hindi ka na muna pupunta sa doktor eh. Pag wala kang nakita, more or less kampante ka na wala kang problema. Pero pag may nakita ka, that's the time you go to a physician to have a check.
Lalo na kung may symptoms ka na.
Right.
Okay. So the symptoms that you mentioned earlier, no? Talagang dapat consult right away. And if your friend notices something, kasi sila yung nakakakita because you see yourself every day in the mirror and you don't notice these changes.
That's
Or
true.
sometimes you are in denial that there are changes. So the best gauge would be your family.
Yes.
I mean, napansin
People around
sila
you.
or people around you or
Yeah.
your friends, no? Or
Check
workmates.
eyes also pala.
Workmates.
Nalimutan, check
the
eyes also.
Oo nga, no? Or photos. Ako, look at your pictures. In
That's
this
true.
day and age of selfies.
Kasi kung minsan pag diffuse toxic goiter, wala eh. Hindi lumalaki masyado.
okay.
Pero ito,
Are there certain types of food to avoid?
Well, ito, common misconception ito, Angel, na kapag ka daw may goiter, ikaw, bawal at dapat kumain ka na kagad ng seafood. Not in all cases. Kapag ka ikaw ay hyperthyroid, sumusobra ka na nga sa thyroid hormone, bawasan mo yun, yung seafood. Kasi lalo lang dadami yung iodine mo na magiging thyroid hormone. Ganon din naman, a common myth is bawal daw kumain ng repolyo, gabi, pechay, talong, cauliflower pagka may goiter. The thing is, bawal lang yun kapag ikaw ay hypothyroid, kulang ka sa thyroid hormone kasi pwede nilang palakihin yung goiter mo. Pero kapag ikaw ay hyperthyroid or normal function, you can eat these vegetables on a regular basis and hindi ka magkakaroon ng goiter or thyroid problem.
And vegetables are good for you, di ba?
Yes.
I mean, fruits, vegetables, the right amount of protein, fats, and
You
carbohydrates.
don't have to avoid all of these cabbages, etc.
Yes.
Okay, the only thing you have to avoid is not consulting your doctor. You should avoid being in denial as well. No?
That's
That it's
true.
just stress or it's some other underlying medical
Ay,
condition.
nalimutan natin yung
Ah,
sa
yes, Doc.
hyperthyroidism, no? Yung mga pag-check sa sarili, hindi lang kasi goiter yung pag-check natin sa mga symptoms. So, if you're suspecting na pwede kang may hyperthyroidism, madalas nanginginig yan. O kaya yung kuko, madaling maputol. No? Pwedeng
Kasi
ganyan.
the bone,
Yeah,
tama
it
ba?
affects the
Calcium?
bones. Yes,
Yeah,
yes,
it
it affects our bones as
Skin
well.
changes. So, yun.
skin.
So, nanginginig silang ganyan.
Oo.
Tapos, yun sa mga doctors, pag hyperthyroid, kung meron kang stethoscope, pinakikinggan yan, yung thyroid gland. Kasi may maingay, na maririnig mo yung parang zzzz, parang yung heart, sumasabay sa heartbeat. Ganon. So, malakas ang blood flow.
Okay. So, given that everything is normal, how often should we get our thyroid checked?
Not very often because as we mentioned, hindi naman magde-develop yung thyroid problem within a span of a year for most patients, lalo na kung wala kang family history. So, ang recommendation, if you do have a family history, kahit once a year, magpa-check ka ng thyroid function mo. If you don't have a family history, kung napagawan ka na ng one time, usually within the next 5 years, you don't need to do a repeat test at all. Unless mag-develop ka ng symptom, kagaya ni Dr. Mia sinabi kanina, na kapag namayat ka, nanginig ka, bigla kang pinagpawisan, doon magpa-check
Check
ka
ka
agad.
na.
Alarming na yun, ano? Okay. Doctors,
For the thyroid
yes.
nodules, pag may thyroid nodule ka na, yun yung kailangan mong bantayan ng mas madalas. Kasi pwedeng biglang lumaki. Pag biglang lumaki yan, konsulta ka na kagad. Baka kailangan ng tanggalin.
Doctors, any final message to all our viewers?
Since we're talking about the thyroid and we all know that it is indeed a very important public health problem here in the Philippines, what I would like to stress is that, una, kung meron pong family history ng thyroid problems, make sure that you have your neck check, go to a doctor, especially kapag meron na ikaw na mga goiter or symptoms na nararamdaman. And if the doctor tells you to take your medicines, please do take them. Kasi po, importanteng gamot.
Okay, thank you, Dr. Nicabel. Dr. Fojas.
Thyroid disease is a very manageable problem, including thyroid cancer. So better have yourself checked by a credible doctor who will be able to take care of you and who will be able to follow up regularly. Yan. And also, we have activities related to Goiter Awareness Week. You can actually access our website at endo-society.org.ph. You can also download some information regarding hypothyroidism, goiter, and thyroid nodules there.
All right, thank you, Dr. Nicodemus and Dr. Fojas, for educating all of us on how to take good care of our thyroid gland.
Thank you very
Maraming
much.
salamat
Thank you.
ulit. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night, everyone.